Hey guys, welcome back to my channel. My name is Irene and I'm a registered dietitian, and today we're talking about the low FODMAP diet. The low FODMAP diet is most commonly associated with being a dietary intervention for irritable bowel syndrome or IBS. And in this video, we'll discuss what the low FODMAP diet is and other use cases for this diet. So before we kind of talk about what the low FODMAP diet is, let's go over what is a FODMAP. So FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are all forms of carbohydrates, and what is special about these carbohydrates is that they are not completely broken down by our bodies. So whenever we eat them or consume them, our gut bacteria tries to break them down, and that can cause water to be drawn into the gut and gas to be produced when our bacteria is trying to break it down, and basically it ferments. And so this is why some people may be a little bit more sensitive to it, and it may cause extra gas and bloating, because when our bodies are trying to break it down, it's not breaking down completely. So FODMAPs can be found both naturally and in processed foods. So the foods that are higher in FODMAPs include onions, garlic, green peas, mushrooms, apples, peaches, watermelon, raisins, cow's milk, yogurt, ice cream, beans, soy milk, breakfast cereals, muffins, crackers, high fructose corn syrup, honey, and candy. And the foods that are lower in FODMAPs include green beans, carrots, potatoes, tomatoes, grapes, kiwi, strawberry, cantaloupe, hard cheeses, lactose-free milk, almond milk, tofu, peanuts, feta cheese, oats, rice, cornflakes, rice pasta, maple syrup, table sugar, and dark chocolate. So as you can see, there are both natural foods and also more processed foods found in both categories. And eating a more like whole foods diet does not necessarily mean that the diet is going to be lower in FODMAPs. So in terms of following the low FODMAP diet, it is a 3-phase elimination diet. So in the first phase, that is when you're eliminating all of the high FODMAP foods, and this phase lasts usually about 2 to 6 weeks. Then in our second phase, which lasts 8 to 12 weeks or longer, you are going to slowly reintroduce those foods back in over the course of 3 days. So you'll start with a small portion on day 1, increase the portion a little bit on day 2, and then increase it some more on day 3, and then you'll monitor your symptoms and see whether or not this food is one that really triggers your symptoms. And then in the third phase, which is sort of like the maintenance phase, individuals will be able to slowly over time understand which foods are their triggers and which foods do not trigger their symptoms. So this diet is highly individualized, and what may trigger one person's symptoms does not trigger another person's symptoms. So everyone's diet on the low FODMAP diet whenever they're in the maintenance phase could differ by a lot. And what I do want to say about this diet is that I think that when a patient is starting on this diet, it needs to be a decision made by the patient and their medical team. It is not suitable for everyone. So some of the things that I think about that are contraindications for starting the diet may be like a history of an eating disorder, or if a patient's just a very picky eater in general, and so starting this diet may reduce the amount of foods that they are able to eat by a lot. So those are kind of the times when I would say that this diet is not suitable for someone. And obviously whenever a patient is started on this diet, they should be monitored by a registered dietitian in the initiation phase, in the reintroduction phase, and the maintenance phase, because the dietitian can help with troubleshooting and also determining which foods to reintroduce first, as well as making sure that we're not having any nutritional inadequacies. So if, for example, there is a certain class of foods that a patient is just not able to eat, we will be able to make sure that they are still meeting all of their micronutrient, vitamin, and mineral needs by suggesting that a patient try some other foods or maybe recommending a supplement. So the most common use case for the low FODMAP diet is IBS, or irritable bowel syndrome, which is a chronic condition that affects the GI tract and can cause several symptoms such as abdominal pain, gas, bloating, diarrhea, constipation. And these symptoms may be triggered by foods or just stress in general. And several studies and meta-analyses have examined the relationship between the low FODMAP diet and IBS, and they have found that the low FODMAP diet can help with managing symptoms and improving quality of life. One thing that I do want to point out is the low FODMAP diet is not a treatment for IBS. It is simply a tool that we can use to help with managing managing symptoms. Unfortunately, IBS is a chronic condition, so these symptoms may never go away completely, but the low FODMAP diet can help with reducing maybe some of the severity or the frequency that patients are having these symptoms. So most studies found that the low FODMAP diet was most helpful in managing abdominal pain and bloating symptoms, whereas there were mixed results when it came to stool frequency and consistency. There are a lot of limitations with some of these studies. Obviously, adherence to the diet is a big one that may vary across different patients or individuals, and then also symptom control is very subjective, so one person may have a higher tolerance than another person for various different symptoms. There were also inconsistent controls in a lot of these studies, so some of them may have compared it to other diet interventions, whereas some other studies compared it to a regular diet or just people that received healthy eating education. Some studies also included or excluded certain types of IBS, so I think all of those different factors really muddied the water. And of course, there's also no long-term studies on the effect of the low FODMAP diet on IBS, which I am hopeful that in the future there will be something, but as of now we don't have a lot of good long-term studies on this. So another use case for the low FODMAP diet is in DGBIs, or disorders of the gut-brain interaction. And I know how it sounds. I feel like a lot of patients, when they hear this term, they immediately think that their healthcare provider is just brushing them off or not taking them seriously, but that is not at all the case. I want to emphasize that patients that have DGBIs are experiencing very real symptoms. But basically, DGBIs are a group of conditions that are related to the way that our gut and our brain are sending signals. So the analogy that we like to use at our institution is the car alarm analogy. So you know how there's like a car alarm for if your car gets hit or something, it'll start going off. And some cars have very sensitive sensors, and so it'll start going off, you're like within 5 feet of it or something. And then there's other cars where like park next to it, you open the door and like you even maybe ding it a little bit and the car does not make any sound. That is basically what we're kind of talking about. So some people are just very sensitive to various triggers. So even the smallest trigger, which people that do not have DGBIs would not even register, may set off like an intense amount of symptoms. So it's more so just related to like our gut is overreacting to maybe some certain trigger and sending that up to our brain, and it's firing off a lot of alarms saying something is really wrong. So sometimes you may see that medications that are traditionally used in psychiatric conditions are also used in patients with DGBIs, and it is not saying that patients have a psychiatric condition or that there's something wrong with their brains. It is simply more so just that those certain medications also have another effect on dulling the sensor of like our gut to our brain and making sure that the car alarm is not going off as soon as you're stepping within 5 feet of the car. Alarms are still going to ring when something's going wrong, but it's not going to be as sensitive as it was before. So IBS is the most common type of DGBI, but other forms of DGBI include reflux hypersensitivity and functional dyspepsia. With these other DGBIs, they can be managed by a low FODMAP diet. There's not a whole ton of evidence really on it though. Most of the studies are on IBS, so I feel like because IBS kind of falls in this category, people have generalized it to other DGBIs as well. Some patients have found that it is helpful, some patients have not. Management of other DGBIs is also very individualized as well. And then I want to quickly touch on some other dietary interventions. So one of them is the low FODMAP gentle. Basically, this is a more liberalized version of the low FODMAP diet, which only removes the very high FODMAP foods. There is also the NICE guideline. So this focuses on avoiding foods that are high in sorbitol, resistant starch, insoluble fibers, and other potential diet triggers such as carbonated beverages, alcohol, and caffeinated drinks. It also focuses on a healthy meal pattern, so things like eating regularly and eating slowly. And then lastly, there may also be just no dietary intervention. So not every patient is suitable for a dietary intervention. It may just be more helpful for certain patients to focus on meeting their nutrition needs and filling in any of the nutrition gaps. So overall, the low FODMAP diet is one that restricts the intake of certain carbohydrates that may ferment in our gut and cause various GI symptoms such as abdominal pain, gas, bloating, constipation, diarrhea, and vomiting. It can be used to manage the symptoms of IBS and DGBI DGBIs by decreasing symptoms and severity, but it is not a treatment for these conditions and it will not cure them. The diet is not for everyone and it should be conducted under the supervision by a registered dietitian if a patient and their medical team decide to proceed with this type of management. Obviously, there is currently a considerable amount of evidence supporting the low FODMAP diet and IBS specifically, and as I like to say, every individual is different, so everyone's treatment plan is going to look different even if you have the same diagnosis. But I hope that you enjoyed this video. If you're looking for other nutrition or dietetics content, I have a ton on my channel. Just look for the dietetics or nutrition nuggets playlist. If you enjoyed this video, please be sure to give it a like and subscribe, and I'll see you next time. Bye!